When should education about headache red flags be provided to patients? When should education about headache red flags be provided to patients? This is an important question for anyone experiencing headaches. Understanding when to seek help can make a big difference in health outcomes. Education about headache red flags should start right at the first visit when patients report headache symptoms. This is especially true if the headache is new, severe, or different from what they usually experience. By informing patients early, they can learn to recognize when symptoms may require urgent medical attention. For those with a history of recurrent headaches, such as migraines, it is vital to educate them about changes in their headache patterns. If they notice new symptoms that are not typical for their usual headaches, they should know to seek care. Age also plays a role in when to provide this education. Patients over 50 years old should receive special attention. Older adults are at a higher risk for serious underlying conditions that could cause headaches. Additionally, if a patient has risk factors or other health issues, education about red flags becomes even more important. For example, individuals with a history of cancer, those who are immunosuppressed, or those taking blood thinners should be informed about the signs that indicate a secondary headache cause. Follow-up visits are also a good time to discuss headache red flags. If a patient reports changes in headache characteristics or develops new neurological symptoms, it is essential to revisit this education. Some key red flags to share with patients include sudden onset of a severe headache that reaches maximum intensity within minutes, often referred to as a thunderclap headache. New headaches in patients older than 50 years should also raise concern. Patients should be aware of headaches that come with systemic symptoms like fever or weight loss, as well as neurological signs such as weakness, numbness, or changes in vision. If a headache worsens with position changes, coughing, or straining, that is another red flag. Papilledema, which is swelling of the optic nerve head, can be detected during an examination and should be discussed with patients. Any headache pattern that is different from previous headaches or progressively worsening should also be highlighted. In clinical settings, it is helpful to provide clear and simple explanations about which symptoms requiring urgent evaluation. Using mnemonics like SNOOP can help patients remember these red flags. SNOOP stands for systemic symptoms, neurologic signs, onset sudden, older age, and pattern change. Encouraging patients to seek emergency care if they experience any of these red flag symptoms is essential. Providing written materials or follow-up discussions can reinforce this education and ensure understanding. Overall, educating patients about headache red flags should be an ongoing part of their care. This enables timely recognition of potentially serious conditions and ensures they know when to seek appropriate medical help.